Hello and welcome everyone. My name is Dr. Manickam and I'm a pediatrician. I went to Brown for medical school, Columbia for residency, and now I'm at Children's Hospital Los Angeles to specialize in the NICU. And today we're going to talk about viral infections. This is a long one, so make sure you save this video and refer back to it if you ever need it. So you might remember from one of our prior videos that for fevers for babies less than 2 months of age, it's an emergency, especially if that fever is in your baby that's less than 1 month of age. If that does happen, you should go to your pediatrician, or especially if they're less than 1 month of age, go to the emergency department to figure out why they have that fever. As you might remember, their immune systems are still developing at that time, or we assume that they are. So we want to make sure that their fever is not due to a bacterial infection that could make them a lot more sick. The reason why we have this video is for fevers after babies are after 2 months of age are usually due to viral infections due to a virus that are not quite as serious and are important for you all to know how to manage at home. That way you don't have unnecessary appointments with your pediatrician or with the emergency department, and you can have more peace of mind. So I'm going to break this down into 4 different parts. So first, how you can take a temperature at home. Second is if your baby has a fever, how you can tell if your baby has an infection due to a virus, like what are the most common symptoms of an infection due to a virus. Third, how do you treat those symptoms and how are they different from treating an infection due to a bacteria? And then fourth, the ways you can figure out if it's actually not an infection due to a virus and something more serious, like a bacterial infection where you do have to go to a doctor to get further treatment. So first, how to take a temperature when you think your baby might have a fever. So the recommended way to take a temperature most accurately is a rectal temperature. So you take a thermometer, you put a little bit of Vaseline at the tip, you put it in roughly ½ an inch into their rectum. If there's any resistance at all, do not push against any resistance. Take their temperature, and if it's above 100.4 degrees Fahrenheit or 38 degrees Celsius, that is a fever. If you are uncomfortable at all in terms of taking that rectal temperature, usually you do it with the baby on their stomach or on their back and you lift their legs up to do so. If you're uncomfortable doing that, you can also take an axillary temperature. What that means is taking the thermometer and putting it underneath their armpit, and that will give you roughly an accurate temperature that can help you guide what you do next. After you do take that temperature and you establish that your baby might have a fever, the second thing is to figure out why are they having that fever? Is it due to a virus? And it usually is due to a virus, which is why we're having this video. The most common symptoms for viruses, as you know, is from a common cold. So a runny nose or a stuffy nose, a cough, for older children, a sore throat. Other viral illnesses that you might be familiar with is like hand, foot, mouth disease, where there can be some vesicles that are painful for your child around their gums. Ear infections can be due to viruses. You can have most pneumonias are due to viruses. And so the way, which goes to our third point, the way you treat them if you do think your baby has an infection due to a virus is what we call supportive therapy. You're just treating their symptoms. Viruses take 3 to 10 days to go away depending on the type of virus. And we only treat bacterial infections with antibiotics. So if your baby has an infection due to a virus, we have to somehow get through those 3 to 10 days, keep them comfortable, keep them hydrated with plenty of fluids to drink to make sure they can get through it. To address some of the symptoms that are most commonly there for viruses, like a cough for instance, that one unfortunately we don't really have any treatment for. Some over-the-counter medications have something called dextromethorphan, but that can only be given for kids greater than 4 years of age. And so there's nothing really you can do for that cough. Sometimes parents will ask, can I give honey to my baby to help them with their cough? And you can't. For babies less than 1 year of age, there is a deadly infection associated with honey. So do not ever give your baby honey if they're less than 1 year of age. The cough, you kind of just have to tolerate. Second, for the congestion that your baby might have, another one of those common symptoms in viral illnesses. The nose Frida is one of the most popular things that parents will use. On one end, there's kind of a blue tube that you place around your baby's nose. The other end, there's a little like contraption for you to suck on. And you just put it on your baby's nose and suck on it to suck the congestion out. It will not go into your mouth, so don't worry about that. And it can be really effective and helpful for your baby. Also for congestion, there are like these normal saline drops you can use. It can help break up the congestion and can also be helpful. The other thing that's important for management for viral illnesses is making sure the whole time that they are sick, that they're drinking enough fluid. You'll notice that they might not eat as much. That is okay, but as long as they're drinking at least 50% of the fluid they usually have, this is like breast milk, this is formula. After the 6 months of age, this is water. After the 12 months of age, this is milk. As long as they're having over 50% of what they usually drink, then they're okay. They can get through the illness. Which brings us to our final point, is how can you tell if the fever is not due to a virus, but if it's instead due to something more serious or a bacteria? And there are a few different things I want you to keep in mind. Number one, are they acting not like themselves? If they're a lot more tired than usual, you can't really wake them up, that is a huge reason for you to go to your pediatrician or go to the emergency department to make sure that they're okay and it's not due to a bacterial infection. Number two, you want to make sure that they are hydrated enough, having over 50% of what they usually drink. They're going to be drinking less than usual, but as long as it's over 50%, then you're usually fine. You want them to be hydrated because they're expending a lot more energy to fight against that infection. Third, you want to make sure that they are peeing enough. This is a great way for you to tell if they are hydrated. They should be having, again, like at least 50% of the wet diapers they usually have. If they don't have a wet diaper for over 8 hours, that's a reason to talk to your pediatrician or seek medical advice, because they might have to be admitted to the hospital for hydration, where they might place an IV and give them fluid to make up for whatever they're not able to drink. Fourth, if there's anything at all that worries you about how they're looking, so this goes without question, but if they faint, if they have seizures, if anything is concerning to you, you should go to your pediatrician or the emergency department in some of those scenarios to make sure that they are okay. And lastly, or I should say two more things, if they're having increased work or breathing, having any difficulty breathing at all, go to your pediatrician. And then now truly lastly, if they have a fever for 5 straight days or more, or if their fever is over 105 degrees Fahrenheit, go to your pediatrician. Make sure that they're okay and that there's nothing more serious going on. Again, this video is full of information, so please save it, refer back to it, ask us if there are any questions, things like I can clarify to help you. And here are a few clarifications for you to keep in mind as you listen to our videos. First, all the information that we share is for full-term babies, so babies greater than 37 weeks gestation and without any other medical issues. So if your baby does not fall within that criteria, make sure you talk to your pediatrician so they can tailor our recommendations for your child. Second, all the information that we share is my own clinical opinion and not related to any of the other institutions I've been a part of before or are currently. And third, for all the medical providers in the audience, if you have any other advice that you would like us to include, please send us a message. We're happy to try to include those things as well. If you find our videos helpful, please like and subscribe to our channel below and share with your friends. Thanks for watching. Take care.